Hello, and welcome to Timing is Everything, a program of Care Dimensions. I'm Mary Crowe, the Director of Professional and Community Education at Care Dimensions. Today, we have with us our Chief Medical Officer, Stephanie Patel. Stephanie, welcome to the show.
Thank you for having me, Mary.
Yeah. So, today we're going to talk about, obviously, a very timely topic, Steph, and it's on the hospice and palliative care during COVID-19. So, before we get started, could you just say a little bit about yourself for the viewing audience?
Sure. I've been the Chief Medical Officer at Care Dimensions for 13 years now, practicing exclusively hospice and palliative care.
That's great. Well, again, really thrilled to have you here because, like I said, this is, we have some challenging times going on right now. And so can you talk to the audience about how has hospice and palliative care been impacted by COVID-19?
Sure. I think that there have been a lot of changes in hospice and palliative care, and a lot of things that have actually really changed the same. Just like everybody else in healthcare, we had to adjust when COVID started in March. So I would say that the big changes are getting used to, wearing some masks and asking people a lot of questions about if they've had symptoms and fevers, as well as, screening their family members and everything in order to keep patients and staff safe. I think the other big change was having to adjust to when we were taking care of a patient that had COVID-19, we had to, wear full protective gear. So everybody had on gowns and masks. And I think that could be, overwhelming sometimes for the patients and the families to see people. And it's hard to tell who people are sometimes in those outfits, as I'm sure a lot of people have seen on the news and other shows. So Care Dimensions, made an effort to make bigger name tags, so patients could recognize who was behind all of that, care.
Yeah, and people that, being a doctor, people think, oh, that you're used to this kind of thing. This is different. This is very different.
Yes, it's very different. Nobody has really gone through, I would say, anything like this. I've been, a practicing physician for 20 years, and I haven't seen anything like it. And I have colleagues that have practiced, for 30 or more years, and they've said the same thing.
Yeah.
I think, we also had to adjust to adding televisits and virtual visits a lot more than we have done in the past. We're very used to in-person visits. I think that adding those avenues of being able to talk and reach out with patients has been very helpful.
Yes.
So I've seen that both on the hospice and the palliative care side.
Absolutely, and it's been very well received.
It has, yes. And what I would say to you, though, is what hasn't changed for hospice and palliative care is we're still doing a lot of in-person visits. We're still available 24/7. We're coming to your house when you need us. And that, I think, has been very important during COVID-19. I think, some people felt very isolated and at home. And it was nice to know that our service was still coming. We're still showing up and providing, the great care that we've always provided.
Yeah, and which is wonderful, and I think that is important because I think the word that just comes full force to me on so many levels during this, Stephanie, is uncertainty, and I think that this has been a major theme. So it's so important that people feel that their health care has not gone by the wayside, and hospice and palliative care is such a central and such a necessary benefit and service to people. So when you were talking about that, it's so important that people have that kind of access. Have we been able to help people? What do they, in terms of what if they don't have a particular device? In terms of being able to do those virtual visits, how did that work out?
Yeah, I think we as an organization found that there are a lot of people who didn't have devices available to them. Some, chose to use their a family member's device, but other patients we provided devices to. We used iPhones that we would provide to the patients in family members, and we had tablets that we were helping nursing home and assisted living facilities so that their patients and could actually sometimes see families, communicate with their own families, but could also communicate with our staff, and we could check in on them virtually more often, and also provide not just the medical care, but that some companionship and some regularity, knowing that there are other people there. I think it was key to a lot of families that our staff was still, able to see and keep touch base with what was going on with their loved ones, because often they weren't able to see them at this point, whether they're far away and couldn't get here, or they weren't allowed into a facility. I think a lot of times our staff was that key connection to keep knowing what was going on with, mom or dad or their sister or brother, whoever it happened to be that was on service.
Yeah, which is so important that people, it really did it has made a big difference in terms of people feeling more supportive, right?
Yeah.
So that's excellent. So talk more about some of the challenges for patients and families, and I also want to hear some of the challenges that staff have also, gone through with this.
I think it was a lot of adjustments for staff. I think that was a big challenge. Again, in healthcare, we are used to being able to see, touch, be close to our patients and interact with them in person. So getting just an adjustment to doing virtual visits. Also an adjustment to all the new protective gear. I think that's also an adjustment for the patient and family. Even now we're still all wearing masks. I think everybody finds that an adjustment. You can't read as much patients' facial expressions. And for some of our patients, that's key in determining if they're in pain, if, they're having some kind of distress. So we've had to adjust a little bit how we're also assessing patients. I also think, as I said before, just isolation for both staff and patients and families has been difficult during this time. So the more we can communicate, whether it's by phone, in person, or virtually, I think that has helped us all, both staff and patients.
Yeah, so really helping with that fear and uncertainty, and also really helping to be a voice, right? And I think that has been a critical piece of this, to have hospice or palliative care services in there. Really, they have served as a voice for the individual, the patient, and the family, haven't they?
Yes, and I think they've also been a consistent medical, health presence. When they've been afraid to go to the hospital, they're afraid to go into a doctor's office because nobody wants to be exposed when they don't have to be. So I think it's a good way that we were a medical presence for these patients and families throughout the whole time. Absolutely.
So, and what happens, because I know some people are concerned too, if they don't have protective equipment, they didn't have masks, how did Care Dimensions have they been handling that?
So there's been a lot of patients and families that haven't had masks. We've been able to give masks. We've had a lot of donations of handmade masks, as well as donations of medical masks. So we've been able to help families obtain that, that necessary protection for themselves.
Which is great, because again, we make assumptions, don't we, that people just have we can see as healthcare organization with one of the other threats, right, was the shortage. Here we are in this pandemic that is totally out of the blue. It's, and the uncertainty, but then feeling a shortage of this, the PPE has been a real issue, hasn't it?
It has, and it's very key to help, again, protecting not just our staff, but also patients and families. So especially early on, there was a lot of concern about whether there would ever be enough of the personal protective equipment. Luckily, we've been able to, obtain a lot of equipment, and we feel that we're ready, even if something were to, again, happen here in Massachusetts.
Which is really great.
Yeah.
And that's important for people to understand, that you don't have to, because I think initially people actually felt like, geez, this is a field like we can't have hospice or palliative care in. Not so at all. Actually, let's use these protective measures, be totally safe about it. But again, how do you get that additional support through a crisis like this?
Yeah, I think some of the challenge we faced was that patients and families and even some of the other healthcare providers thought we were not seeing patients, we weren't taking patients, that we had somehow closed our doors, which was absolutely not true. And then there were patients and families who were afraid, thinking we might bring something into their house and expose them. But being very cautious and utilizing a lot of the protective equipment, that helped to prevent that, as well as the fact that if patients felt more comfortable using a virtual visit and they had a tablet or didn't and wanted to utilize one of our phones, we were able to do that. And I feel like we were then able to provide very good care even to patients that really were not wanting people entering into their home.
Absolutely. And again, I've heard from many people how reassured and how supported they have felt through the virtual visits, that it was much different from what they had imagined that it would be.
Yeah, I think that people found it very easy to use, but also that many of them, it was just like FaceTiming, and lots of people have used FaceTime. And so it was just, instead of FaceTiming with a family member or a friend, this was doing the same with a caregiver or provider or nurse.
Absolutely. I just want to go back to what you said for a second also, which was, that people thinking that hospice had closed its doors, or Care Dimension then you said there's no such thing. The hospice never closes its doors, and certainly Care Dimensions never closes its doors, does it?
No, it doesn't. Not in the 40 years that it's been open. I don't think there's never a day that it has closed, and we definitely wouldn't do that when we felt like we were needed so much. This would be a time where people really needed services that could go into the home. They could avoid hospitalizations or facilities. So I feel like for us, it made absolutely sense that we would continue to be available for whatever people needed. It was also a key time for having those, difficult conversations, and even, what if I got COVID-19 and was in the hospital, what would I do? So our palliative care service, saw a lot of people calling even themselves saying, I think that my mom and I need to have this conversation. And so we were very available to have those kind of goals of care and advanced care planning, doing a lot of 5 wishes and filling out those type of advanced care planning forms.
Yeah, absolutely. So let's talk about this, because again, I think that this is really important, is some of these benefits that you're talking about of palliative and hospice care, and how this has really been a major support for patients and families at this time. And that's one of them. So again, we assume that healthcare workers, just that they all know how to have these difficult conversations and they know how to do this. What I have found is, I've had many calls that, people, they need to have information. They need to have the tools for their tool belt to do this. Palliative care, this is what they do, right? They're well versed in this. And so this is another key component of, don't keep us at arm's length, bring us in, because these are the things that we really excel at.
Yeah, and again, it's always been to make sure that in times when you're not in a crisis, you can actually talk about and think about what you would want if something were to happen. Because when you're actually in that crisis, that is a lot more difficult. And I think what we found was people thought about it a lot more around COVID and what would happen. So we got a lot more questions regarding whether we could have those conversations. A lot of people wanting to do those virtually. We'll go back to that. They didn't really want a provider to come into the house, but they really felt like the providers could help their family. So often the nice thing about the virtual conversation is it allowed us to have people from other states and, their family member all on the same call, working through those kinds of decisions, and now they would have a plan. I think the other thing we found was there was a lot of people that couldn't get in to see some of their specialists or get in touch with people because so many people had to be sent into the hospitals to help care for those patients in the hospitals. And so we really did provide a lot of symptom management as well, so that patients on palliative care could stay at home instead of having to go to the emergency room or the hospital.
Right, which people, again, wanted to avoid. That's
Correct.
not where they wanted to be, to have those types of conversations. You know, and these conversations, what I have found too is that because people might be in one of those high-risk groups, again, and they wanted to have these conversations, but then felt like, geez, do I have access to the physician, and they could reach out and have these conversations. Like you said, virtually it's good. I mean, there are other options that you utilize during these times. We also have advanced care packets here, and that we've had many people either email us or call us and asking if they can have a copy of that, which has a healthcare proxy in it, which has copies of 5 wishes and also honoring choices in it. So if people is that something that they're interested in, we can get that to them.
Absolutely. And again, I usually when people call, that also opens up the idea that some will say, oh, well, I may need help filling this out or going over it. And that's the perfect opportunity for a palliative care consult. And again, we like to do that with family members, not just a conversation, with a patient by themselves as well, to make sure if you've chosen a healthcare proxy that they know what your wishes are and what you think is important and what matters to you.
Exactly. So people considering what is it that I want for myself, making sure that that's, and picking that person who you want to be your voice when that day comes that you can't speak for yourself, but then also making sure that people around you know what's important to you, and then also translating and having those conversations with your physician.
Yeah.
So that the physician knows what your wishes are in that way.
Absolutely. I think it's very key to not just have a form filled out. You have to have a conversation, and you have to include who you've designated, plus your physician, all your medical providers. And I think that palliative care is key to helping people work through that and process through all of those decisions that they have to make.
So can you talk just for a minute about the palliative care, like criteria, how people would go about that if they felt like, geez, I would want to have, who would benefit from it? Who would benefit from a palliative care consult?
So palliative care really is designed for anyone who's living with a chronic life-limiting illness. So that could be, somebody who has cancer, that could be someone with CHF, dementia, neurological disorders, even kidney disease or liver disease. That's just to name a few. There are a lot of them. Anybody living with a disease like that would benefit from a conversation with palliative care, as would their family member, because a lot of times, their specialists are targeting their disease modifying therapy that's going to help try to cure them. At the same time, we're going to focus on, okay, if you're having difficulties with any kind of issues that are affecting your quality of life, we're going to help try to focus on those and how can we improve your quality of life, as well as making sure that everybody knows how you want to live your life and what matters to you, and how you can make decisions that are consistent with those values.
Yeah, I always say, Stephanie, that, if you're diagnosed with a serious or a life-limiting illness, one of my first calls would be to palliative care, because this is a time to really have some conversation and make some determinations on what that journey is going to look like.
Absolutely. And it may change as you go along. So people will have palliative care when they're diagnosed, and then they may have it, a year later, and, things may be different. So I also tell people it's not a one-time visit. It's something that we also continuously work with you. And again, just like hospice, it's very much focused on your quality of life, and it is in conjunction with all of your other curative medical active treatments.
Yep, absolutely. So what we can do is, and if people are, again, if they have a question about it, they can call the main number, right, which is 888-283-1722. So I'm going to repeat the number for you. So 888-283-1722. So if people have questions or, they want to know if this is something that could be of benefit to them, they should reach out.
Absolutely. And there's somebody that will answer that those questions and get them the information 7 days a week.
Excellent. So in terms of, talk a little bit, Stephanie, about the Home MD program, and what does that look like? I don't think some people even understand anything about the Home MD program that we have here and how that could benefit also people during COVID-19.
Sure. So the Home MD program is really primary care brought to your home. So it is designed for people that have difficulty getting out of their home and getting to their regular doctor's office. The physician or a nurse practitioner actually comes out to your home. It is very personalized care. We are able to provide everything that a primary care office has. So we have connected with the ability to get blood draws and x-rays, and again, the physician and nurse practitioner coming out to you. So it is not so difficult to get into the office. What we find is sometimes then people put off going in, and then they end up in the hospital. So this is a great service, and during COVID-19, it's been absolutely wonderful for the patients who have their PCPs as part of Home MD, because we've continued to come to them. And again, we've using the personal protective equipment that they've been able to do. We are now, able to test patients in their home for COVID-19 as well, if we're suspecting that any of our patients have come down with the illness. And again, it's very personalized, I think, care for those people who usually are homebound because they're chronically ill and have they may have oxygen, they may have dementia, for whatever reason, it's difficult to them to get to their doctors.
So really, I could see that when you were talking, it's like it's a benefit in general for these groups of individuals, but and how can it helps the families tremendously, doesn't it? Yes. But then again, here we are in terms of this pandemic, and it just magnifies the importance and the benefit that could pose for people.
It does. Again, we didn't close our doors, so we were out seeing patients, and so I don't know that any of these patients noticed any difference in their care during the pandemic.
Yeah, which is wonderful. Are they accepting new patients? Is Home MD accepting new patients?
We are accepting new patients, and in fact, throughout the pandemic, we continued to get calls and saw new patients.
That's great. That's great. So and they could call that main number that I had given earlier and ask for Home MD?
Correct.
Yes. Yeah, and again, it really does help people to feel at home, to feel safe and supported again. So just one of those main benefits that it has for this Home MD program. So, I know that we have only a short time left. The time goes by so fast when you're talking about a topic which is so important. But also, just if you have just can mention about the hospice houses. And we have the Kaplan Family Hospice House and also the Care Dimensions Hospice House. Just talk about that, because some people have asked about the visitation and had questions about that. So do you mind just speaking to that for a minute?
Sure. So the hospice houses, again, have also been taking patients in throughout the pandemic. And we have been accepting visitors. So we are allowing 2 visitors at a time in a patient's room. and usually trying to keep it to around 6 different total visitors per patient, but that has not been an absolute. But it has been nice for patients to be able to have contact with their loved ones during this time.
Yeah, and that's wonderful because, as we know, in some of the other medical types of settings, that's not been the case. People have felt extremely isolated from their loved ones, particularly when, again, they were in life-threatening situations. So that is wonderful to hear.
Yes, and we felt it was very important in, people at the end of life needed to see and physically be with their loved ones during that time. So
absolutely. Well, Steph, the time has run down here, but I just want to ask you, is there anything, a last comment or note that you just want to send to the viewers before we wrap up?
Yeah, just that they remember that we're here for them whenever they need us. And again, we will come out in person. We will do virtual visits, telephone visits, whatever you're most comfortable with, but that all of Care Dimensions programs are really here to support people to be able to stay in their homes and get through this pandemic.
Excellent. Well, so yes, we certainly want and wish that everybody would call if they need us, because we're certainly here for them. So I want to thank you so much for coming on the program today, the show, and sharing this very important information. And again, Dr. Stephanie Patel, who is our Chief Medical Officer. Thank you so much, Stephanie.
Thank you, Mary.
So I want to thank everybody for tuning in to Timing is Everything today. And again, my name is Mary Crowe, Director of Professional Community Education, and we look forward to you looking on our future shows.
Home. More than ever, it's your sanctuary. But if you're caring for a loved one with advanced illness, it can feel isolating and worrisome. Care Dimensions can help. As Massachusetts' leading hospice provider, you can count on us for guidance, medical care, and support. We follow all COVID-19 safety precautions to protect you and your family, so you don't have to delay getting the care you need. Visit Care Dimensions online or give us a call.